Hey guys, this is Dr. Hub. Today we'll look at the neurological examination in terms of the intervertebral disc prolapse. So in short, we are calling it as the IVDB. So first we look at the L3 and the L4. So the disc affected, we are going to see the L3 and L4. So in terms of the L3, L4, what is the root usually compressed? The root usually compressed is going to be the L4. So the reflex, if you see the reflex, it is diminished. So the reflex is diminished or reduced. So what are the seen? So the reflex reduced, it includes a knee jerk. So it involves a knee jerk. So knee jerk is basically the weakness of the quadriceps femoris. So knee jerk, it involves the weakness of the quadriceps femoris, and that is nothing but the Westphal sign. It is nothing but the Westphal sign. Next we move on to the motor weakness. So in terms of the L3, L4, it was the decrease in reflex, the knee jerk and the weak quadriceps femoris is the Westphal sign. Now when you look at the motor weakness, under the motor weakness, it involves the quadriceps femoris and the hip adductors. Then we move on to the decreased sensation. So a decrease in the sensation. So what does decrease in sensation involve? So decrease in sensation, it involves the posterolateral thigh. So we are calling it as the PL, the posterolateral thigh. Next is the anterior knee. So it involves a posterolateral thigh. There is an anterior knee. Next is the presence of the medial malleolus, that is nothing but MM. Then comes the medial foot. So decrease in sensation, we have the posterolateral thigh, there is the anterior knee, there is the medial malleolus as well as the medial foot. Now we look at the pain distribution. The pain distribution in this case, it involves the anterior thigh. The pain distribution is nothing but the anterior thigh. Next we move on to the L4 and the L5. So L4 and L5, the root which is usually compressed is going to be the L5. And what is the reflex which is diminished? The reduction in the reflex is by the medial hamstring reflex. It is the medial hamstring. It is going to be the medial hamstring reflex. Now let's look at the motor weakness. So under the motor weakness, so this was with the L4, L5 and mainly compressed is the L5. So it involves a motor weakness of the tibialis anterior. We are writing it as TA. Then the extensor hallucis longus, EHL, the gluteus medius, the G medius, and the EDL, that is the extensor digitorum longus, and the brevis. So it involves the TA, tibialis anterior, EHL, extensor hallucis longus, the gluteus medius, as well as the EDL, that is the extensor digitorum longus, and the brevis. Now there is a decrease in the sensation. So the motor weakness, this decrease in sensation of the L5. So the muscles involved here is the compartment, that is the anterior leg. Then there is a large toe. There is a large toe web. So it involves a anterior leg. It involves a large toe web, anterolateral leg, anterior and the lateral leg. Then it involves a large toe web, as well as it involves the dorsum of the foot. It involves the dorsum of the foot. Next is the pain distribution. So in terms of pain distribution, it is nothing but the PL leg. PL leg, we stand for the posterolateral leg, is nothing but the PL leg. So we saw the L3, L4, L4, L5. Now we move on to the L5 and the S1. So under the L5 and the S1, there is the root which is most commonly compressed is going to be the latter, that is the S1. So what is the reflex which is diminished? The reflex which is diminished is nothing but the ankle jerk or the Achilles tendon. So it is nothing but the ankle jerk, or you can call it the Achilles tendon. Achilles tendon. So what are the motor weakness? In L4, L5 it was the tibialis anterior, extensor hallucis longus, the gluteus medius and the extensor digitorum longus and the brevis. Whereas here it is going to be the PL. What are the motor weakness? The motor weakness is going to be the PL. PL stands for the peroneus longus as well as the brevis. Then there is the gastrocnemius and the soleus complexus. The gastrocnemius and the soleus complexus. Next, there is also the presence of the gluteus maximus. There is gluteus maximus which is involved. And when you move on to the decreased sensation, the decreased sensation is that of the lateral malleolus. So decreased sensation was on the lateral malleolus and also the lateral foot. So it was of the lateral malleolus, it was the lateral foot and also the heel. So lateral malleolus, lateral foot, heel, and then comes the web of the 4th and 5th toes. Then comes the web. This is of the 4th and the 5th toes. So commenting on the pain distribution. So how is the pain distribution here? The pain distribution is going to be the posterior leg. So in terms of the L3, L4, we saw the anterior thigh. In the L4, L5, it was a posterolateral leg. And in terms of the L5, S1, it is going to be the posterior leg. It is going to be the posterior leg, as well as often involves the ankle. So it also involves the ankle, and it's also the posterolateral leg which is involved. To learn and grow daily like this, please do subscribe.